Our oldest enemy is not viruses, nor famine, but a traitor that accidentally awakened within our own bodies. The story begins with a torture session that took place in a living room. In 1810, 58-year-old novelist Fanny Burney, unfortunately, developed breast cancer. At the time, her only chance of survival was to lie on the operating table and entrust herself to 7 men wielding steel scalpels. There was no anesthesia back then. In a letter to her sister, she recalled, "The scalpel pierced my breast, cutting through veins, arteries, muscles, and nerves, one by one. She could clearly feel the scalpel scraping back and forth across the bones in her chest, scratching repeatedly. This 20-minute linky, slow slicing torture must have felt like a lifetime to her. Yet miraculously, it allowed her to live 29 more years. This became humanity's first creed in fighting cancer. A rule written in blood and screams. Find it, then dig it out." However, when anesthesia silenced the cries on the operating table, breast cancer treatment only became more brutal. And the person who pushed this brutality to its peak was William Stewart Halsted, the father of modern American surgery. Halsted, he introduced surgical gloves, solely to protect the hands of his beloved nurse. He even dared to remove his mother's gallbladder on his own dining table. But the other side of this genius was that while researching cocaine, he unfortunately became a slave to the drug. Later, he became addicted to morphine during withdrawal treatment. Perhaps due to the paranoia brought on by drugs, Halsted firmly believed that cancer was like a drop of ink spilled on a tablecloth, spreading outward in a radial pattern. The only way to cure it completely was to cut off that piece of tablecloth, along with all suspicious tissue around it. Everything. In 1894, he proposed the radical mastectomy. It was like an excavation project. The scalpel cut through not just the breast, but also the pectoralis major muscle and lymph nodes. Sometimes, even the ribs had to be removed along with them. Halsted's method allowed 40% of patients to live for more than 5 years. But almost at the same time, British surgeon Stephen Paget, after studying 735 cases, discovered that cancer cells did not spread like ink at all. Instead, they were like seeds, traveling through the bloodstream to distant soil, to take root and germinate. Paget was right, but his voice was drowned out by the halo of Halsted's heroism. For nearly a century, during this period, hundreds of thousands of women suffered unnecessary mutilation on the operating table, sacrificed to a wrong theory. When the limitations of the scalpel were fully exposed, humanity began to pray to 2 invisible weapons. One was radium, discovered by the Koreans. It could emit deadly radiation, which could necrotize and shrink cancer tissue like magic. For a time, radium became a sacred relic sent by God to end cancer. It was made into face creams that made skin glow, radium water for strengthening the body, and even radium-containing chocolate and toothpaste. However, the myth collapsed quickly and tragically. The first to fall were the workers who had close contact with radium. Young female workers, in order to paint radium-containing fluorescent paint on watch dials, were taught to lick the tips of their brushes with their lips. They swallowed radium into their bodies day after day. After work, their bodies would glow with a charming faint light, earning them the nickname Radium Girls. A few years later, their teeth fell out for no reason. Their jawbones shattered like hollowed-out rotten wood, and they suffered severe bone pain all over their bodies before dying soon after. At the same time, devoted consumers of radium also paid with their lives. American millionaire Eben Byers drank approximately 1,400 bottles of radium water over 2 years. In 1930, his jawbone began to necrotize and fall off, and uncontrollable tumors grew all over his body. A dark joke in the newspapers read, "The radium water worked perfectly until his jaw fell off." In the end, he also became a footnote to radium. The birth of the other weapon originated from hell. During World War II, a US military ship carrying the chemical weapon mustard gas was hit by German forces. When military doctors treated the poisoned soldiers, they discovered that this toxic gas dealt a devastating blow to rapidly dividing white blood cells. If the gas could kill normal cells, could it also kill the even more wildly dividing cancer cells? After the war, this idea was brought into the laboratory. Scientists used nitrogen mustard, a derivative of mustard gas. For the first time on a patient with advanced lymphoma, the patient's massive tumor shrank rapidly within a few days. Modern chemotherapy thus emerged from humanity's ugliest invention, breaking through the soil. Since then, the 3 classic treatments, surgery, radiation therapy, and chemotherapy, achieved great success in the mid to late 20th century, but they were like carpet bombing. While destroying cancer cells, they also turned the patient's body into a scorched wasteland. The real turning point came after the molecular biology revolution. Scientists began to delve into the interior of cells to decipher the genetic code that drives cancer. They discovered that the uncontrolled growth of many cancers originates from mutations in 1 or 2 key genes. In 2001, the first targeted drug, imatinib, was launched. It precisely attacked the specific defective gene, unique to chronic myeloid leukemia. Overnight, a disease that was once fatal turned into a chronic condition that could be controlled with a daily pill. However, cancer cells, masters of evolution, can always find new mutations to escape. In the end, scientists turned their attention to the most powerful army within our bodies, one that had long been overlooked: the immune system. We once thought the immune system was just blind, unable to see cancer cells disguised as one of its own. But in the 21st century, scientists discovered that cancer cells have evolved a perfect set of diplomatic tactics. They will actively shake hands with the brake molecules on the surface of immune T cells, politely handing over a passport identifying themselves as one of the team, thus paralyzing the entire army. This discovery gave birth to immunotherapy. Its role is not to directly attack cancer cells, but to kick away that deceptive handshake between cancer cells and immune cells. It releases the immune system's brakes, allowing the deceived army to re-identify and eliminate the traitor. And CAR-T therapy has taken this concept to the extreme. Scientists extract T cells from the patient's body, genetically engineer them in vitro, to equip them with a navigation head that can accurately identify cancer cells, then infuse these modified super soldiers back into the body. These T cells become a type of living drug, patrolling and hunting on their home turf, without rest or mercy. But this is ultimately a war against our own destiny. It is far from over, and may never end. Because cancer is not an external invader, it is us. It is just an ordinary cell in our body that, after billions of ordinary replications, by chance, broke free from the ancient constraint called collective interest, and picked up life's most primitive, most selfish urge for infinite proliferation. It uses all the beautiful mechanisms we have endowed life with: vascular endothelial growth factor, metabolism, to betray life itself. It is an inevitable consequence of humanity's increased lifespan, and a biological paradox, where cells seek immortality but end up in self-destruction. When individual cells pursue infinity, they are destined to disrupt the order of the whole. When a species as a whole draws closer to longevity, the more traitors there are within its bodies. Therefore, we may never invent a perfect weapon that can completely eliminate betrayal. But what we are learning to do is shift from eradication to management, from war to peacekeeping. We will eventually redefine the upper limit of health. In the gray area of controllable coexistence, on that day, cancer may still exist, but it will lose the power to dominate our destiny.